Now we're going to focus on the thumb. This shouldn't be terribly long. There are a few unique muscles. Just a reminder that the thumb, your book makes reference to what is called flexion and extension of the thumb. That we're going to call radial AB and adduction. Adduction is the flexion, abduction is the extension. I'll go over that in class. We also can do movements, and these are at the CMC joint, by the way. The CMC joint of the thumb can also perform palmar abduction and adduction. So, but we will do this in class a little bit more detail. So as we look at flexion and we look at the thumb and we look at the MP joint because that's a pretty clean flexion, the thumb itself has primary muscles that control just the thumb. And when we see that, we're going to see the word pollicis. So when we see something that pollicis, that's going to tell us that something controls the thumb. The flexion of the thumb is controlled by the flexor pollicis brevis and the flexor pollicis longus. Now the flexor pollicis longus is going to extend beyond the brevis, obviously. So it's not only going to control the MP of the thumb, but it's going to control the flexion of the IP of the thumb. However, because it goes over that first MP joint, it does help to control flexion, MP flexion of the thumb. Or, like I said, MP is also MCP, metacarpal phalange, or MP. So extension of the thumb involves two different muscles. The primary muscle is extensor pollicis brevis, which comes just over the top of the MP joint of the thumb and stops. And then extensor pollicis longus, which goes beyond that over the top of the IP joint and then inserts at the tip of the finger. So if you take your hand and put your thumb into sort of an exaggerated state of extension, you'll notice two tendons, if you will, down at the base of your thumb that form a little pocket in between them, and we call that the anatomical snuff box, which is kind of a silly name, but it is. That's how it's known very well. Okay. Now, look at movements of the IP. The IP flexes, and there's where the flexor pollicis longus has traveled all the way out to the tip of the finger on the palm side to create flexion. And we also have the extensor pollicis longus, which goes all the way out to the tip of the finger, crossing over the IP joint. So those are the muscles associated with the thumb extension and flexion at the IP. Adduction of the thumb. We have a strong muscle in the palm or in the hand called the adductor pollicis. So we know that it is an important muscle that controls the thumb. And if you could see this a little bit better, that pointer is actually pointing to the top part of that muscle, whereas this second point that comes in is actually pointing to the thinner piece of muscle, but we'll go over this in class. Opposition. So there are some muscles that control opposition, and we have the opponens pollicis. Okay. We also have the flexor pollicis brevis that contributes to the motion of opposition. So you'll remember I said that opposition is really not like a true motion that occurs at the CMC joint because it's combinations of things. So we see a flexor and we see the opponens pollicis, and then we also see an abductor pollicis. So it's the combination of flexion and abduction that gives us the ability to produce opposition of the thumb. Now the small finger, as we mentioned before, it gets its own name. They call it the digiti minimi. So we have a flexor digiti minimi. We have an opponens digiti minimi that helps to bring that small finger around to meet the thumb in opposition. And then we also have an abductor digiti minimi. Okay, so all responsible for that movement of the small finger into assisting with opposition. So a couple of things I want to explain a little bit. Now, recall that some muscles in the hand are intrinsic and some are extrinsic. In this case, you can see these muscles with a red portions on the slides, they're intrinsic. The extrinsic muscles actually originate in the forearm and travel all the way out to the hand in many cases. So that would be designated on this slide. You'd be able to see those as those white strands that look like they're in the palm there. The other thing I want to talk to you about is on the hand. If we look at the palm, the base of the thumb has a big sort of piece of meat there, and that is called on the palm side at the base of the thumb. That's called the thenar eminence. It's an eminence. It's something that stands up higher than the other parts. And then on the pinky side, we have something similar, not quite as big, but it's called the hypothenar eminence.